Start, doctor.
Hello, I am Dr. Hussein, one of the doctors today. Just for confirmation, am I talk with Mr. John, 45 years of age?
Yes, doctor.
Okay, I have been informed that you travel with some rash. Can you please tell me more about this?
Yes, doctor. I had this rash since 3 months, doctor. And I visited the GP and informed me to refer to you, doctor, today.
Okay, and is it for the last 3 months only, or previously you also noticed this type of rash?
Yes, doctor. I noticed this from 3 months, yes, doctor. Yes.
Okay, and where you notice it first? In which area?
When it started, where it started? I-
Where?
Yes,
Which part of the body you
in my
notice it
hand,
first?
doctor. In my hand and my leg and in my face, doctor.
Okay, and your hand, face, and your neck. Can I see the rash?
Yes, this is my hand, doctor. It's okay.
Okay,
And if you want my
and
face,
you
this is
also
my face. This is my face and my around mouth.
okay. And in your feet, this rash is also present.
Yes, what doctor? I'm sorry, the voice not clear. What, doctor?
In your feet, this rash is also present.
No, not feet, doctor. Not feet.
Only in your hand and your mouth.
Yes, in my hand, in my foot, and my hand and my leg, and my mouth, around my mouth and my face. Yes.
Okay. And do you feel any pain when you press over it?
No, doctor.
Can you feel it?
Not feel it. No, doctor.
Okay. Any itching?
Not itchy.
Any oozing?
No, doctor.
Okay. And I also informed that you're suffering from some shortness of breath. Can you tell me more about this?
Yes, doctor. About 2 months now, I had shortness of breath with any activity, doctor. Not like as before.
Okay. Is there any particular part of the day you feel more shortness of breath, or is throughout the time?
Voice not clear. Voice not clear. Again, Dr. Hassan, please.
Okay. The shortness of breath. Do you find anything make it better?
Rest. When I take rest, doctor, yeah, it's okay. No shortness.
Okay. And when you stand up, you notice a shortness of breath is more, or when you lie down, the shortness of breath is more.
No, doctor. With activity, with any activity, doctor.
Okay. And I also informed that you are suffering from some fatigue. Can you please tell me more about this?
Fatigue. Fatigue. Yes. So this, as I told you, doctor. I feel tired all the day. Don't want to do doing anything. Not want to go my job because I'm tired.
Can anybody tell you that you are become pale day by day, or you notice it?
Yes, doctor.
Okay. And do you feel dizzy?
Yes, sometimes, doctor. Yes.
Okay. Is it all the time, or when you stand from sitting position?
Sometimes from stand, yes, doctor. And as when in my job, doctor, I feel dizzy and cannot complete my any job in my hand.
Okay. I'm really sorry to hear that. I will try my best to help you today.
Thank
And
you.
do you have any Thank you very much. Do you have any family history of such type of things?
No, doctor.
This type of rash?
No, doctor.
Okay. And can I examine you and talk to you at the same time?
Yes, please. What you want?
Okay, I wanted to check his hand. I wanted to check his pulse,
Yes.
and I want to check his eye for anemia.
His eye. His
And
eye. Yes. His eye.
yes, I wanted to check his lips and his tongue for telangiectasia.
Yes.
And I also wanted to check his chest for looking for any bruit for arteriovenous malformation.
Excellent.
And I also wanted to check his tummy.
Yes.
And just for one question, do you notice any change in your bowel habit?
No change in bowel habit, doctor. Normal.
Okay, passes of any black terry stool or alter color stool?
Yes, sometimes. Yes, last week, doctor, I feel my stool changed to some red. I seen some red color in my stool, doctor. Yes.
Okay, how long exactly you suffering from this symptom?
I'm not sure when it started, but I last week I just see this red color in my store.
And when you flash it, do you notice that blood is coming out like this?
No. I'm fresh. It's okay. No problem.
Okay. And other than this stool problem, do you ever coughing out of blood or bleeding from your nose?
Yes, 1 month ago, yes, the doctor, when one time I had attack of bleeding from my nose, and I visit my GP and give me some medication and stop, doctor.
Okay. If the examiner allow, I wanted to examine his tummy, especially the look for any organomegaly, and also
Yes,
for hepatic bruit,
yes,
and also wanted to do the parectal examination, if examiner allow.
it's okay, it's okay.
Okay. And have you ever been a smoker, sir?
Yes, Doctor Smokers.
Okay, sir. Remind you that smoking injurious to the health, and if you want, I will more than happy to refer you to the smoking cessation clinic. Do you ever drink?
No, doctor.
Okay. And what you do for living?
I am engineering.
Okay. How much these symptoms affect your daily life and job?
As I told you, doctor, I felt this tired all time and take a lot of sick leave this 3 months, doctor, because
Okay,
I
I'm
get
really sorry.
yes,
Okay, I'm really sorry to hear that. And in the medical term, I will try to manage you by giving some medication and other form of investigation. And if you want, I also can help you through occupational health worker in
so
these regards. And I also advise you to inform your occupational health department in your workplace, and they can help you in this regards.
okay.
And
So what I have, doctor? Please inform me what I have, doctor.
y- yes, sir, I come to your concern. And this is only your concern. What's going on, or do you have any other
Yes,
concern for?
yes,
As I talk to you and do some examination, the possibility I have in my mind is, in medical term we call it hereditary hemorrhagic telangiectasia. Don't bother yourself by the name; it's a fancy name. I will write down it for you. And do you have any idea regarding this?
no, doctor. What's this, doctor?
Okay, it's a familiar condition, although I doesn't find any family history in your case, but it's run in the family. And in this type of disease, the symptom you're experiencing of some rashes in the hand and your mouth, and you're complaining of bleeding, you're complaining of ultracaral stool, and the shortness of breath, all can be explained by this disease. And the concerning thing is, I found that some blood count is low in your case. So if it is remain untreated, and I'm afraid to tell you that it may be complicated. So in this time, as I found the blood count is low, I wanted to admit you
Yes,
and run some investigation in emergency basis, and give you appropriate treatment accordingly. So is there any problem with admission?
no problem, doctor. Thank you, doctor, very much.
Thank you
One
very
question
much.
also, also, doctor. This condition can affect my son, doctor, or my sibling, doctor.
Oh, I understand it, and I acknowledge it. And yes, there is a possibility. As I said, you this is a familiar condition. But for more discuss regarding this, I will be more than happy to refer you to the clinical geneticist in this regards. And as your concern, is there any possibility? Yes, there is a possibility. About 50% chance to not get the disease, and 50% chance to get the disease is each of your son and daughter.
It's okay. Thank you very much, doctor, for your
Thank you very much. It had been a pleasure to meet with you.
thank you very much. Uh, Discussion with examiner. What's your diagnosis, doctor?
So my diagnosis is hereditary hemorrhagic telangiectasia.
Yes. What positive sign you are finding in this case?
So the physical findings are, I found telangiectasia involving in his hand and feet and his leg, and I also found the telangiectasia in the lip and the oral cavity.
Yes.
I also found that the patient is anemic, and these are my positive findings.
So okay. So what's the case of what's the causes of this fatigue of human breast? What's the cause?
The causes of fatigue is, I can explain, is the anemia, which is due to the gastrointestinal bleeding, and patient is also give the history of melanoma.
Nose bleeding, yes, nose bleeding, I think it's okay. What about for what's the treatment for management plan for this patient?
Okay, management plan is multidisciplinary team approach. I wanted to involve the specialist, doctor specialist, the rheumatologist, my consultant, and also his GP and the specialist nurse. And for specific management, for acute bleeding, the tanoxamic acid can be helped. And in case of GI bleeding, there may be sometime arteriovenous malformation. So resection of that part, if it is can be treated medically. And for his current condition, I wanted to replace blood and also give the iron and other hematopotics as
It's
needed.
okay, excellent. What a mode of inheritance in this case?
I aware of that is autosomal dominant.
Yes. So about how much about what's the percentage of the his son or his family, his sibling?
Yes, there is a 50% chance to develop this disease and also 50% chance to not develop this disease, each
It's
of the
okay.
child.
Excellent, doctor. Thank you, Dr. Hassan. Thank you very much, Dr. Hassan.
Thank you very
Uh,
much, sir.
Thank you, Dr. Hassan. So, as our case today is intense case, very, very important case, is very simple case and common, is hereditary hemorrhagic telangiectasia. Skin rash with fatigue and short of breath. Dr. Hussein doing well. First doctor doing well, but he left everything about skin rash and concentrate in the short of breath and details of short of breath and time taking away and lost the case. So okay, no problem. We are here to catch our defect to correct it. Any before my comment, anyone has any comment to Dr. Hussein? I want to add anything to if any defect in the scenario, we can take your opinion. If anyone has any opinion or any defect in this case,
Just need to add if sorry to interrupt. Just need to
yes,
add if we could keep ITP as a differential.
ITB.
Idiopathic thrombocytopenic purpura.
Yes. I know. But Berbera. You want to Berbera? I want Berbera is branching. Berbera is branching with pressure.
Yeah, it does blanch.
Yes,
Yes,
yeah,
it does
branch.
blanch.
But يعني I think difficult to bring in the acute case is ITB يعني. But it's okay. You have to ask everything. But I think branch cannot branching. It's okay. But this distribution around the mouth and the tongue and you have see telangiectasia. يعني telangiectasia is common feature or common
Yeah, this is
telangiectasia. Yes, it's common in the characteristic.
HHT.
Yes,
Right.
yes, shape of
This was very evident, but if in differentials,
yes,
we can
can
keep it.
differentiate. Yes, in differential
Yes.
diagnosis. Yes,
Yeah.
as you
Yes.
know, in station 5, you don't want you don't want what differential diagnosis, but in what differential diagnosis in the history, no problem. But
Okay.
station 5, you wanted to give the accurate or spot diagnosis for the case. It's okay.
Right.
So if you find
Right.
rash in
Thank
the
you.
mouth and the tongue and telangiectasia, shape of telangiectasia, it's common in the hereditary hemorrhagic telangiectasia. It's okay. So
Yes.
I can edit the shape of telangiectasia if anyone not know the shape. I will edit moment.
Oh, this was very evident. The case was very evident. Right.
It's okay. Maybe moment. If I find in my home moment. This shape of telangiectasia. This shape of telangiectasia. If anyone don't know the telangiectasia is the shape of telangiectasia. It's okay. So
Right.
dilated visits in anywhere, but this is character of the this telangiectasia. It's okay. Is anyone has any another comment on the in Dr. Hussein? Anyone has any comment? It's okay. So I will comment the case to arrange our ideas about the case. Inshallah, to be easy to everyone. Our case today is hereditary hemorrhagic telangiectasia. The case is Mr. John, 45 years old, present with skin rash, with fatigue and short of breath. If you find in the scenario before the station skin rash So, okay, and fatigue, shortness of breath, mostly shortness of breath, يعني shortness of breath fatigue think in the anemia, mostly not basic, but you have to think in the anemia. So, okay, and if skin rash is anemia, think in the hereditary hemorrhagic tinnitus mostly. So, okay, so we start with as we're doing with any case. Good evening, good morning, as your time. I am doctor today in senior officer today in my clinic today. Nice to meet you. Nice to meet you. You are Mr. John, 45 years. Yes, doctor. Please, can you give me what's your complaint? Please, doctor, yes, I have skin rash started 3 months ago. I am sorry about that. Please, can you, when it started, please, started 3 months ago, start gradually or suddenly, doctor, your Mr. John, suddenly or gradually, on and off or all the time, increasing or decreasing or improved or the same. It's okay. Please rapidly can, because short time in the station 5 as you told you, please show me the skin rash. Please, can I see the skin rash? Yes, doctor, in my hand, in my face, in my tongue. So, okay, you can from the first look, you if you common case, you can diagnose it. You can catch the diagnosis early if it can help you in your differential diagnosis. So again, when it started, suddenly or gradually, on and off or all the time, increase or decrease or the same. Is anything increase the rash or is anything decrease the rash? No, doctor, the same. Painful, oozing, itching, blanchable. It's very, very important to differentiate. Why differentiate the diagnosis of the skin rash? You can differentiate between this question: painful or not painful, because painful and non-painful; oozing or non-oozing, because an infection; blanchable or non-blanchable; and itchy or non-itchy. Very, very important. Itchy or non-itchy, very important. So now you analyze the rash. Analyze the rash. You can, if you catch the rash early, you can guide you what's your diagnosis. Another one. So I read only also, Mr. John, you are complaining also with fatigue or shortness of breath. Can you inform me more about it? Yes, doctor. I had shortness of breath 2 months ago with any activity, doctor. I am really sorry about it. Is start suddenly or gradually? Can you also analyze the complaint? Shortness of breath start suddenly or gradually? Yes, gradual, doctor. Increase or decrease? Increase, doctor. Is anything improves the shortness of breath? Yes, doctor, with rest. So يعني most common shortness of breath, the most common cause mostly is anemia. Mostly is anemia. You can ask mostly in the female also and in male. You can ask about is anyone inform you are pallor before the more than before? Yes, doctor. I start to be my wife informed me I has more pallor than before. So you have to search about the cause of this anemia. So, okay. So you have to any bleeding from anywhere. Please, if anywhere bleeding from anywhere, yes, doctor. You have bleeding from your nose? Yes, doctor. 1 month ago, I have one attack of bleeding from my nose. What about your bowel habits? Any change in your bowel habits? Is any bleeding or is the blood in your mouth habit? Or your bowel habit? Yes, doctor. I saw some blood in my stool or my bowel habit. If any history of cough, blood before? No, doctor. So you have to rapid reach about the cause of the anemia. So, okay. And if the female, what about your period? Is any change in period amount of your period in our number of pads changed or increased in your period? It's very important in the female. So you start now to analyze the systemic review, rapid systemic review from above to below. In this case, you know, the hereditary hemorrhagic tinnitus have very important to exclude AV malformation in anywhere. So from above to down, as we told, not forget anything. Maybe AV formation in the head, in the CNS. You have to ask rapidly any headache, any nausea, any headache, any vomiting, any change in your conscience, any numbness, any tingling, any weakness, rapidly for any change in your vision, because maybe AV malformation in the brain. So be present with headache, or numbness or weakness or change in speech or change in visual habit, visual problem. Nose, very important. Any bleeding from nose, very, very important. From down, as we told, the tongue and the mouth is rash in mouth, tongue. In the chest, you have about the chest condition. Any cough of blood, very, very important. Cough of blood, cough of blood, shortness of breath, or noisy chest. The cardiac, you have to ask about what about any chest pain, racing heartbeat? If you ask about racing heartbeat, yes, I have racing of heartbeat because this anemic features, racing of heartbeat, chest pain, and leg swelling because there any edema. GIT, you have to ask any tummy pain, any tummy pain, any tummy swelling because you have about ascites, any blood in stool, very or blood in your bowel habits, or vomiting blood, maybe hematemesis, or hemopsis for cough of blood or vomiting of the blood. You have to ask about hematemesis. And about the family history, very important. Family history of similar condition, yes or no. What about your job, smoker, non-smoker? And examination, rapid examination. You can examine the patient during talking. Can I examine you while you are talking? Yes, doctor. You have start from above to down. Not forget anything. Start from above to down. So you start with the eye, very very important. Is pallor. It's okay, and show the examiner you search about the anemia sign. So okay, so look in the eye. It is pallor. So everything in the second thing in the mouth, you have to this rash in the lips, and your please can I show your tongue, this rash also in your tongue, and me in the face you have this female as tenectasia. This tenectasia in the face is classical case, and so the hand and hand rapid look in your hand, any clubbing, any another rash. It's okay. So we start with check show rapid cardiac examination, GVB, maybe congested, pulse, very important, maybe tachycardiac, and both the stethoscope, maybe auscultation for about any congestion or any crepitation or any bruit, search about any bruit in the cardiac, pulmonary, also pulmonary bruit, very very important for AV information. So we examine الeye, الماوس, الهاند, الشيست, CVS, and الابdomen. Can examine abdomen, maybe examiner inform you no problem, no need. Or if you find about any organomegaly, any bruit also, because AV malformation. And in neuro examination, I think no one tell you neuro examination. So doctor, please, what's the cause of this rash, doctor, or why is this causing this shortness of breath or this fatigue, doctor? Yes, from our discussion today, mostly Mr. John, you have problem is multisystemic problem called hereditary hemorrhagic telangiectasia. It's causing dilatation of the superficial blood vessels or blood conduit, and this skin rash. This causes this dilatation can cause this bleeding from your nose and bleeding from in your bowel habits. Is causing this anemia or this fatigue, cause this fatigue what you complain. So this patient is symptomatic patient, this symptomatic anemic symptoms. So you need to admit you to hospital, Mr. John, and doing some investigation in some blood test and some maybe some scans, to مثلا searching in scan, and I will refer to multidisciplinary in the form of gut doctor and chest doctor and ENT doctor because it's bleeding, and try to and him a blood doctor, and try to correct this drop in your hemoglobin or your blood to correct this anemia. So, okay. So doctor, please, this condition can transmit or can affect any one of my siblings. I am really sorry to inform you, Mr. John, this condition is run in families, can affect about 50% of your son. But we can doing screening or genetic screening. I can refer you to genetic specialist to doing screening to search the percentage of how anyone can be affected from this condition. It's treatable, doctor. I am really sorry, it's not treatable condition, but we have to correct it. If any have any defect or any problem in your blood, we can manage it by give you some correct this anemia or this drop in your blood by give you blood or some supplement as iron or vitamins to correct this problem. And another doctor, chest doctor or cardio doctor, will give you plan of management. I think is a very common case and very simple case. Common exam is hereditary hemorrhagic telangiectasia. Okay. Is anyone has any comment or start another case? is one has any comment? It's okay. So this, inshallah, if we finish